Thank you, Laura, and good afternoon, everyone. It's really an honor and a pleasure to spend a few minutes with you because it's clear to me that the standard of care does not work, and I, as a basic scientist, understand that the standard of care in applied pharmacology cannot work based on how we're designed and how the human body works. But I thought today I would give you just kind of a teaser, but I think it's important for all of you on here to understand nitric oxide signaling in the human body, because hopefully after this little teaser in my lecture, you'll realize that your body cannot and will not heal without restoring the production of nitric oxide. And I'll share with you what goes wrong in people that can't make nitric oxide and how this contributes not only to mental health issues and psychological disease, but really systemic disease. And then recognize that mental symptoms as it relates to this particular talk are just manifestations of systemic disease and due to the lack of nitric oxide production. So as Lori said, I've been doing this for 20 years, and really my research program has focused on four things. How does the human body produce nitric oxide? What goes wrong in people that can't make nitric oxide? What are the clinical consequences of such? And then how do you fix or restore the endogenous NO production? And I think this has been a really challenge, because when I started in the nitric oxide field in around 2000, it was 2 years after the Nobel Prize was awarded. There were about 45,000 papers published on nitric oxide. Today, there are over 165,000. But if we focus on mental health, over 44 million American adults have a mental condition, and it doesn't seem to be getting better. So that tells me that the way we're treating these patients isn't probably the best approach. But if you look at the published literature, the people with mental disorders have an increased risk of heart attack and stroke. Similar results in sexual dysfunction. Now, this could be both ways. We know that a lot of the psychotropic drugs, particularly SSRIs, for the treatment of depression lead to sexual dysfunction. But even some of the unmedicated patients that have mental disorders show an increased risk of sexual dysfunction. And it goes even further. Mental disorders appear to increase the risk of peripheral vascular disease or peripheral artery disease, in which is a circulatory problem in which you have poor blood flow to the legs. And so you get intermittent claudication, you get pain with walking. So these are clear vascular disorders. It's clear that if you have an increased risk of heart attack and stroke, that's a cardiovascular event or a cardiovascular problem. It's now recognized that if you have sexual dysfunction in both men and women, well, that's a vascular problem. If you can't increase blood flow to the sexual organs, you can't get an erection, and that's both a penile erection and a clitoral erection. So again, it's a blood flow problem. And then PAD, obviously a blood flow problem. So if we ask ourselves a very simple question of what's the common denominator? Why do people with mental disorders have an increased risk of heart attack, stroke, PAD, sexual dysfunction? That's just to name a few. Could go on and on. But the common denominator is low blood flow. Well, what controls blood flow? Well, that's where nitric oxide comes into play, because this is not just necessary and sufficient for treating mental disorders, but it's necessary and sufficient to treat all systemic vascular problems. And there's not a single human chronic disease that's not characterized by hypoxia or ischemia or low blood flow. So if we fix blood flow and we fix circulation, we allow the cardiovascular system to do what it's designed to do, which is deliver blood, oxygen, and nutrients to all cells of the body and take away the waste products, then the human body heals itself. Cells regenerate, cells do what they're designed to do. But all this is dependent upon adequate circulation and blood flow, which is dependent upon the production of nitric oxide.